Hey, this is Jeremy, and today we're going to be talking about bleeding. We're going to be talking about, the arterial, capillary, venous bleeding, and we're also going to be talking about how to identify where bleeding may be coming from in a medical and trauma patients. So to start off with, arterial bleeding, that's going to be coming from your arteries. It's highly oxygenated. It's bright red, and it's in a high pressure environment or coming from a high pressure environment. And so that's whenever you're going to notice that it's going to start spurting. And if it starts spurting, it's going to spurt with the pulse, which is going to let you know that, again, that's an arterial bleed. And you're going to lose a lot of blood very, very rapidly. Now, next you have venous bleeding. Venous bleeding is going to kind of pour out. It's a low pressure environment. And same thing with capillaries. Capillaries, it's going to kind of ooze out, and it's going to be darker in color than what you would expect from an arterial bleed. Now, that's just the general terms for the arterial, capillary, and the venous bleeding. But whenever you have bleeding on the inside, you're not able to see that, and so that's kind of going to allow you to actually use your assessment skills to figure out where somebody may be bleeding from and what the cause may be. So anytime you have somebody that has a hematoma, that's going to let you know that there's internal bleeding of some type, which lets you know that they could just have a couple ruptured blood vessels or tenderness in that area, and just it's going to allow you to look at somebody and say, hey, they got injured right there, or they have blood accumulation right there. This is especially important for the abdomen and the chest. And so anytime you have somebody with a hematoma, kind of be suspect, and because we can't see the bleeding doesn't necessarily mean that they're not bleeding. Now you have hematemesis. Hematemesis is a combination of words, hema meaning blood, emesis meaning vomit. So if you have somebody with hematemesis, they are vomiting up blood. And if there's kind of two ways to look at it. If it's a bright red, that's going to let you know that it's coming from the esophagus, and it may have just oozed down and agitated the stomach a little bit, and your stomach vomits it up. Now, if you have somebody that vomits up something that's called coffee ground emesis, that's going to let you know that they actually have digested blood. And so that means that the blood has had time to kind of sit inside the stomach for a little bit before they actually vomited. And so that could mean that they have a bleed inside the stomach. It could mean that they just have blood leaking out of the esophagus into the stomach. It could mean a number of things. But if you have somebody that has that bright red vomiting blood, that could be an esophageal tear from Mallory-Weiss syndrome or anything like that. And so if it's coming from the throat, it's coming from the stomach, which means that's coming from essentially your the top part of your digestive tract. Now, if you have somebody with hemoptysis, they're going to be coughing up blood. Now, this is important, medical and trauma-wise, to let you know that they have a lung injury, or a lung issue. For example, if you have somebody with congestive heart failure, left-sided heart failure, blood's backing up in the lungs and it's diffusing across the alveolar capillary membrane, allowing blood to get into your actual alveoli, bronchioles, bronchi. You start coughing that up, we're going to see that. Now, if you have somebody that is a trauma patient, for example, that could let you know that if they got hit in the chest and they start coughing up blood, maybe they have bleeding lungs. Maybe they have a blast injury, or if they were close to an explosion. It's just going to be letting you know kind of the way that the direction that you need to be taking your care to. Now, if you have jumping to the lower GI tract, we have melena. Now, melena is a black, dark, tarry stool, and that indicates that you have lower GI bleed. Now, this could be at the lower portion of your small intestine. This could be in your large intestine. It's just kind of it's digested blood. So melena is a dark, tarry stool, and so what it means is that you have blood coming from somewhere. So if that dark tarry stool is very tarry and it's not very liquidy, that's going to let you know that it's coming from higher up in the GI tract. So, for example, the purpose of your large intestine is to reabsorb fluids. So if your large intestine reabsorbs all the fluids from that blood that's passing through it, that lets you know that it's from high up, or from very high up in your digestive tract. the closer you get to the opening of the rectum, the less digested it's going to be, the brighter in color it's going to be, which leads us to hematochezia. Now, hematochezia, that's actually blood. It's bright red blood going through the anus. So you're pooping out bright red blood. And so this is going to let you know that that blood is coming from close to the opening of the GI tract, or the end of the GI tract. So if and you're going to see this with hemorrhoids, and that with the disruption of the blood vessels and the bleeding that can cause with the hemorrhoids. And so if so if you have hematochezia, it's bright red blood and is close to the opening of the anus and the rectum. Now, be suspect if you have anybody with an abdominal injury, especially for pain, guarding, swelling of the abdomen, if they have a hot belly. These are all things that you can kind of help guide your assessment into knowing that they do have a bleed. And you combine that with assessing for hematoma. So if they have Cullen sign, or Gray Turner's, or Battle sign, or raccoon eyes even, those are all going to let you know that they have blood accumulating in those locations, which means that they have significant amounts of bleeding. And you also need to pair that with their skin color, temp condition, and their heart rate. So if you have somebody who's lost a lot of blood, their heart rate's likely going to be up. If they've lost a lot of blood, they're likely going to be pale versus cyanotic, which lets you know that there's no perfusion happening. It's not just shunting necessarily. Now, you also need to be on the lookout for broken ribs. So if you have a break of the first to the third ribs, so right there next to your clavicle, that could let you know that they actually have an aortic disruption or aortic dissection. And combine that with what we know about blood loss, that's going to cause your patient to rapidly decline. And you need to do what you can to get them to a place of where they're going to be able to receive surgery. Now, if you have breaks of the ribs on the lower left or the lower right, you have very large organs there that may actually get lacerated and cause you to bleed out internally. So if you have somebody that fractures their lower left ribs, be on the lookout for a spleen injury and abdominal tenderness, guarding, bleeding from there. And if they do have that spleen injury, they could also have left shoulder pain, and it's the referred pain from the spleen injury. Now, on the right side, you can actually, or the right side, whenever you break those ribs, you can actually also cause damage to your liver. So, and if you damage your liver, you can actually have right-sided shoulder pain. So, if you have right-sided shoulder pain associated with trauma to the chest or abdomen, it's likely a liver injury. If you have left-sided shoulder pain with trauma to the chest or abdomen, it's likely going to be a spleen injury. And so these are all kind of things that you can use to assess where the bleeding's coming from, how to best direct your patient where they need to go, and just in general, using these assessment tools or this terminology to kind of know where the blood's coming from, how bad it is, and doing what you can do to help your patients out. And that's bleeding for us.